Health officials in China are heightening efforts to curtail the spreading of respiratory infections in the country. According to local doctors, in the last few months, more children needed to be hospitalized due to the increase in the mycoplasma infections causing pneumonia and other illnesses. Despite the prevailing situation, health officials have urged parents to remain calm and make sure that their children receive proper treatment. Let's have more details of that in this report.
Monitoring data released by the China Centers for Disease Control and Prevention showed some respiratory illnesses have been increasing in recent months. There have been increased rates of mycoplasma pneumonia and influenza.
Since
the spring of this year, common respiratory illnesses in children such as respiratory syncytial virus and influenza virus have appeared. Since the summer and autumn, mycoplasma pneumonia infections have been on the rise, reaching its peak in September and October.
According to Dr. Tang, in the past few months, there were a lot of mycoplasma infections causing pneumonia, and more children needed to be hospitalized. The recent influenza virus mainly caused fever and upper respiratory tract infections, and fewer children needed to be hospitalized. Tang also outlined the hospital's measures for coping with the surge in out-clinic patients.
Every year in autumn and winter, our hospital encounters an increase in the number of patients with respiratory infection illnesses. Our hospital has added more than 10 internal medical outpatient clinics in the evening, focusing on respiratory illnesses, and increased the number of doctors attending during the day.
Many parents are worried about infections leading to more serious conditions. Dr. Tang said most of these common respiratory infections, if the symptoms are mild, will not lead to worse conditions. However, some patients, such as those who need to be admitted to an ICU or who need mechanical ventilation, need to be carefully monitored. Doctors advise against panicking or excessive worry about children contracting respiratory diseases. However, parents should ensure their children receive proper and timely treatment. A spokesperson for China's National Health Commission suggested opting for primary medical and health institutions if the child has mild symptoms to avoid long waiting times or cross-infection at larger hospitals.